Good afternoon, everybody. We're going to give it just a couple more seconds here to let everybody else get signed on who's trying to join, and then we are going to start with today's program. So just about another 5 or 10 seconds here, we'll get rolling. Well, good afternoon, everybody, and thanks for taking the time to join us today for the latest episode of the Towards Zero Deaths Conference webinar series. Last session, we covered the topics of community engagement strategies for teen driver safety and parent awareness programs. Today's topic is impacts to traffic safety during a pandemic. I think everybody will find today's discussion interesting, thought-provoking, probably a little bit frightening, but always informative. So I look forward to today's discussion. My name is Mike Hansen, and I currently have the privilege of serving as the director for the Department of Public Safety's Office of Traffic Safety, and I serve as one of the 3 co-chairs for the statewide Towards Zero Deaths program. Next slide, please. Today, I want to begin by thanking our sponsors who are making the webinar series possible for us, beginning with the National Highway Traffic Safety Administration, the Minnesota Department of Health, the Minnesota Department of Public Safety, and the Minnesota Department of Transportation. I think everybody on this call today understands that we are in a very difficult place in Minnesota when it comes to traffic safety issues. 2020 has been tragic beyond many measures. As of today, we stand at 35 fatalities ahead of where we were at this time last year. If we continue on this pace, sometime in the next 5 days or so, we will surpass 364 fatalities, which was the total for all of 2019. We are on a bad track, and we have a number of significant challenges ahead of us. Certainly, everything that we do is affected each and every day by the COVID pandemic and how we've been forced to react to it and adjust our practices to that. When we look at the contributing factors, speed and impairment are by far and away the most significant human behaviors that are resulting in the tragedies that we're seeing on our roads. When we throw in lack of wearing seatbelts, that's just the exponent that has really put us in a very difficult spot. It's going to take all of us working together to eliminate those factors as well as the distraction factor that we still deal with each and every day. So I want to thank everybody for what you do each and every day to keep our roads safe, encourage you to double down on your efforts, and let's see if we can end 2020 in a better spot than we're at today. Next slide. I'm going to begin today's presentation by honoring a real pioneer and a very deserving gentleman in the traffic safety world in Minnesota. This year's recipient of the Kathy Swanson Outstanding Service Award is Mr. Howard Preston. Howard was most recently a senior transportation engineer at Jacobs Engineering before retiring in 2018. He has dedicated his 45-year career to improving traffic safety across the state as well as across our great country. Howard has led many traffic safety studies and has been a pioneer in helping to develop new methods to reduce fatal and serious injury crashes across our nation. He has played a key role in developing the County Road Safety Plans, which is an effort to develop and identify safety projects on local roads in all Minnesota's 87 counties. He has developed guidebooks designed to help local agencies improve traffic safety and has developed and taught courses for Minnesota LTAP and for the University of Minnesota. The Minnesota TZD program has been greatly influenced by Howard's direct involvement in developing the effective data-driven approaches that drive our goals and our projects each and every day. In addition, his approach to prioritizing highway safety spending has played a significant role in saving thousands of lives. Howard, on behalf of the co-chairs, congratulations and this is a great honor for me. Would you like to say a few words?
Thank you. And folks, good afternoon. I'd like to share 3 thoughts with you. First, I'm so very thankful for my friends that made this happen. I've thought about a lot over the past few months. I've not been able to come up with any better words than a real heartfelt thank you to each of you. Please know that the time I've spent working with you has been the highlight of my career. Next, what an honor to be included with this distinguished group of professionals that represent the universe of the traffic safety field, education, enforcement, emergency response, engineering, and a distinguished judge. What an honor. A final thought, but first I need to share just a brief story. A few weeks ago, I read an essay in the Wall Street Journal about innovation, and I was particularly struck by one particular point, which was that very few important things are done by individuals. They're done by teams. And so the last feeling to share with you is gratitude for the opportunity to have been part of such an outstanding team. All the members of the team were dedicated, hardworking. They gave their time and talent. And I really don't have time to name everyone, so I will take it by groups. First, I'm grateful for the support of MnDOT's traffic safety program managers. They really got it. They understood that if your trend line is going in the wrong direction, you can't continue doing the same thing. You need to innovate. And they supported the efforts to create new analytical tools. They invited new partners in to participate in the State Safety Improvement Program. They approved a new list of safety strategies and a new way of identifying high-risk locations for safety investment, places that had been overlooked in the previous safety plans. So it was just really amazing how they changed the way safety investment was done for the better across the state of Minnesota. Next up are MnDOT's district traffic engineers and the county engineers. I am grateful for their faith in the process, such that they were encouraged to do the really hard work that it takes to do implementation. A written safety plan doesn't save any lives or prevent any crashes. It's the implementation that comes from that. And these folks, the MnDOT's district traffic engineers and the county engineers, were just outstanding in leading the way to making investments at places that had never been part of the previous safety programs, these high-risk locations. They are so easy to overlook using the traditional methods. I'm grateful for the really exceptional analytical staff and the work that was done by my colleagues at CH2M Hill, Jacobs, and SRF Consulting. Really smart, talented, dedicated folks. And I'm grateful for the opportunity to have worked with them. I'm grateful for the efforts law enforcement made when they filled out the crash reports that are the basis of Minnesota's analytical tools that are available through the crash record system. And it's what they did that allowed us to really understand and finally put together some causation with the crashes that are so scattered across the system. I mean, 90% of the road systems and the elements of it don't have any crashes in a 5-year period. So their data was key in allowing us to understand what relationships exist. And then one last point. I've participated in highway safety studies from the West Coast to the East Coast to the Gulf Coast. And eventually there has to be a conversation with each state about what their crash record system can provide in the way of data, in the way of analytic capabilities. And I've always come away feeling a bit of pride, knowing that Minnesota's system is the envy of the rest of the country. And finally, I'm grateful for the man who has had a significant role in making that happen, Mr. Lauren Hill, and the fact that he still considers me to be a friend. So with that, I will end and just say once again, I can't find the words that thank all you folks enough. It's just a really incredible honor. Thank you.
Thank you, Howard. And again, our heartiest congratulations on a very well-deserved recognition this afternoon. And now I'm going to turn the program over to today's moderator, Christine Hernandez, who serves as the statewide program coordinator for the Towards Zero Deaths program. So Christine, I'll turn it over to you and take it away.
Thanks, Mike. Like Mike said, I'm the state TZD coordinator at MnDOT's Office of Traffic Engineering. For those who may have joined late, I'd like to welcome you again to the webinar Impacts to Traffic Safety During a Pandemic. We have a fantastic lineup of speakers for you today, but first, a few housekeeping notes. If you've got a question for our speakers, please put it in the Q&A box at the bottom of your screen. You can also ask for technical help through the Q&A box. We'll get to your question at the conclusion of the presentations. However, if there's a question that needs immediate attention, I can interject at the appropriate time. There are continuing education credits available. To find the forms, please go to the Impacts to Traffic Safety During a Pandemic website. Today's webinar is also being recorded. The PowerPoints will be posted on the TZD website, minnesotatzd.org. For our law enforcement viewers, post-board credits are also available. Please read this important announcement from the post board. If you're watching this webinar live, please watch the webinar in its entirety, and the University of Minnesota will submit the affidavit of attendance report to the post board for you. If you're watching a recorded version of this webinar, please complete the affidavit of attendance on the TZD website and email it to tzd@umn.edu. Instructions are also on the website. Now on to our topic today. We have multiple speakers. Our first speaker is Colonel Matt Langer. Colonel Langer with the Minnesota State Patrol has been a Minnesota State Trooper since 1999. He began his career at the St. Paul Station, where he worked the afternoon shift. He spent more than 4 years on the Metro Crash Reconstruction Team, where he reconstructed hundreds of fatal and serious injury crashes. He was the director of the State Patrol's Fleet and Asset Management section before assuming the public information duties. As a captain, he directed public information work, homeland security efforts, and the traffic safety grants. He served for 2.5 years as the assistant chief and a year as the acting chief before being appointed colonel, chief of the State Patrol in January 2015. Colonel Langer has a master's degree in public and nonprofit administration, as well as a bachelor's degree in criminal justice and law enforcement. In addition to his work at the State Patrol, he holds an adjunct faculty position at Century College. He is active on the International Association of Chiefs of Police Board of Directors and the State and Provincial Police Division Executive Board. I will just say, before I turn it over to him, I want to let everybody know that the Minnesota State Patrol has released another powerful video available for sharing with your communities. It's called 8 Seconds, One Fatal Distraction. And we'll be showing that at the conclusion of the webinar today. And with that, I will turn it over to Colonel Langer.
Hey, thanks, Christine. I think my video should start if someone, the host stopped my video, but if you can hear me, I'll kick right off. Here we go. I appreciate the bio. Those of you that probably know me know that's like the most uncomfortable, agonizing 60 seconds to have anybody talk about me. But, one of the annual rites of passage that I just so enjoy is being part of the TZD conference. And typically I'm sort of at the end on day 2, and that's a little bit what we're trying to replicate today. And I just am so appreciative for a couple things today as I think about what 2020 has brought toward law enforcement. And this will be touched on, for sure, by Sheriff Torgerson and others, but it's an opportunity today to literally spend time on traffic safety because it's so important and it's so near and dear to my heart. It's why I wanted to be a trooper in the first place. It's why I still thoroughly enjoy my job. And it regrettably this year has been a challenge to really stay focused on traffic safety because there's just been so many other challenges that have been thrown at us, not the least of which is COVID, which we're going to talk about today. But it's always good to be in front of a bunch of people, even virtually, who believe, like I do, that we can make a difference, who believe, like I do, that none of the traffic fatalities we have are acceptable, that they're so easily prevented. And yet this year we're wrestling with a rising rate in the number of people that have been killed on our roads. And so today I just think it's so important that we take some time and really focus on what we've done, dig deep within ourselves and figure out what we can do different. And then probably, like everybody, figure out how we can really remain focused on something that's so important to every one of our communities. Much like COVID, traffic fatalities don't discriminate. They hit every part of the state. They hit men, they hit women, they hit all people of color. They hit every race, they hit every socioeconomic status. And so any of us that use the roads or have loved ones that use the road should take this seriously. And it's just great to be in front of a group of people that I'm preaching to the choir with. When I think about 2020 and some of the challenges, when I think back to March, April, when the COVID-19 crisis was really unfolding in Minnesota and there was a lockdown period put on the state. And like all of you, I was really wondering what this was going to look like from a traffic safety perspective. And the folks at MnDOT did a great job. I worked with Assistant Commissioner Hippus because I knew that there's really good data that can be found by MnDOT. And they had wonderful data that started to show just this rock drop plummet of volume when it came to traffic on our roads. And they actually did an awesome job at bifurcating that amongst the regions that I think right away gave a good perspective on what the effectiveness of a state lockdown or stay-at-home order was in terms of how many people were using the road systems, which seemed to be a good indicator as to how many people were staying home or going about their lives like they normally would. And we saw that plummet, which was followed closely by, oh my gosh, I wonder if this is going to have a really good positive trend on our fatalities. And I think we've all discovered that initial theory that if you see the volume plummet, you should also see the traffic fatalities plummet. That has proven to not even a little bit be the case. And we're not alone in Minnesota because I think other states are grappling with the exact same problems that we have seen with COVID-19 and the impact to traffic safety and on our roads and traffic enforcement. And so it's been a struggle to watch the volumes decrease, which of course brings some advantages like decreased congestion and other things that can be helpful. But the number of people that have been killed on our roads continues to be an unintended consequence of the COVID pandemic and some of the traffic pattern changes. And I have a theory about that I'll save toward near the end. But in terms of actually what we've seen, the speeds are up, and most people know that. The number of citations written by state troopers year to date this year versus last year for motorists traveling in excess of 100 miles an hour is double, just less than double what it was last year. So that's a significant statistic, especially when you consider the overall number of traffic stops is down across Minnesota and for the State Patrol for a variety of reasons. But obviously the number of people that are on our roads speeding is at a level that we probably have never experienced before. and that's created an incredible challenge for us. The number of motor vehicle pursuits in Minnesota continues to grow exponentially too. And we've seen that happen again this year in 2020, and we're really trying to figure out why that is the case. I think that there might be some potential correlation between COVID and the other issues in society that are driving that, but we're hopeful that the University of Minnesota and Dr. Nicole Morris and her team are working on some research related to pursuits. I also know that the Police Executive Research Forum is convening a work group to deal with pursuits, and NHTSA is extremely interested in looking at the issue of vehicle pursuits because they correlate to so many of the issues that we have with traffic safety and the disorder in our communities. The fatal crashes are up, and they're up significantly, and that is really concerning to me and everyone else here, because we believe that none of them should be happening yet, and yet they happen. And the 8-second video that we're going to show at the end, that talks about 8 seconds, one fatal, really underscores each person that's involved in these fatal crashes represents a tragedy that is unique to their own, but they represent families, they represent kids and parents and friends and loved ones. And I think the opportunity to really close this session out by learning about what killed Robert Bursick and left his wife and kids without a dad and a husband, I think is really important for us as we reflect on the critical nature of our mission and some of the backtracking that we've seen this year on the progress that we've made on reducing fatal crashes. We've certainly had our share of staffing challenges with the State Patrol. We've been swept into dealing with civil unrest. There was about a 2-week period of time after Memorial Day, after George Floyd's death, that every single state trooper was deployed to the metro. We've never done that before in our history. I hope we never have to do that again. It was a difficult decision. It was the right decision. And we were thankful, and I'm still thankful, that the 87 sheriffs and their deputies and the police chiefs and their officers stepped up to the plate and helped in our absence. And if there's one lesson learned that I think is really helpful in that tough decision, is that communities missed their troopers. They missed the enforcement that was going on, and they missed the presence of seeing the troopers on the highways, because we know that the presence of a marked squad car, even for those of us on this call, the presence of a marked squad car changes behavior, and it changes behavior in a good way. And so the staffing challenges that we've had as we navigate the issues related to civil unrest have been real for us. We have not, thankfully, had an outbreak, a large outbreak of COVID-19 within the Minnesota State Patrol. We have about 600 sworn troopers, about 300 other support staff on any given week, because we're tracking it actively. We've never had more than 10 troopers that have COVID or are recovering from COVID at the same time. I hope that continues. We have some advantages, and I think Sheriff Torgerson might touch on this with some of the issues that he faced specifically. But because troopers are deployed across the state of Minnesota, they have their own squad car, and they never really associate in the same building together. We don't have roll calls. They don't go to like centralized offices often. That provides some advantage for us that we're not congregating as much as local police officers, and in some cases, sheriff's offices have to do it in order to be effective with their work. I'll tell you a couple of things that are concerning to me. One is the overall drop in traffic enforcement. And I did some looking late summer. And if you take about the time period of June and July, August this year, 2020 versus 2019, you'll see statewide there was about a 43% drop in the number of traffic citations issued by law enforcement in Minnesota. And I think that's concerning, and that troubles me when we think about what's going on in our communities and what's going on with our roads. I think we're unfortunately finding ourselves in a space where many law enforcement agencies are considering whether traffic law enforcement is where it is on the priority list or where it is on the spectrum of their priorities. And I think a lot of officers are thinking the same way. And yet we know that the outcome on our roads is poor for the people that are using the roads. And so one of the things that I'm considering is how we challenge ourselves as the law enforcement community in 2021, well, starting now, but certainly into 2021, to refocus, recalibrate our efforts on the things that we know that kill people. And it's the same stuff that we talk about all the time. You've heard me say it. It's the same stuff we tell our kids and tell our neighbors to stay safe. We say wear your seatbelt, no exceptions, never drive impaired, never drive after you've been drinking or using drugs, don't speed, and by all means, pay attention. And those four things continue to haunt us on the roads right now with COVID. I think some of the changes in bar patterns and drinking habits, I don't know that there's anybody drinking less right now, but the way that they're drinking has changed. And we see a lot of impaired driving problems. Saw one this morning with someone who actually assaulted one of our troopers, and we're still trying to catch him as we speak, but was likely impaired by alcohol, if not other things. And the drug impaired driving problem on our roads has just continued to grow exponentially. So we certainly have our work cut out for us. But if I sort of close with what I opened with, our mission is so very critical. It's so absolutely important. It's important to every single one of us. And I can't help but even though I eat, breathe, and sleep this mission and believe in it wholeheartedly, every time I watch the videos or see the victims or meet with people or talk with those that have lost a loved one, it just like stirs within me how important it is that we continue our good work and collaborate, because you've also heard me say, and it's as true today as it ever was, we're never going to enforce our way out of all of the problems on our roads. It's never going to happen, and it wouldn't be successful. So the work together across the E's, the engineers, on what you do to make our roads safer, to engineer our way out of the human behavior dynamics that cause problems, the educational aspects, the enforcement aspects, and absolutely for sure the EMS. I've met with victims that are alive today and have recovered that for sure, decades ago or years ago would have had much different outcomes and not nearly as successful as they are today because of just the amazing work that's being done in our EMS regions across the state. As I close, I have the opportunity to sit on the statewide trauma advisory council, and I've said it there before, and I'll say it here, that we should never take for granted the trauma system that we have in Minnesota, the network, the hospitals, the availability that we have in our state. It certainly makes a difference. And the other role I have is sitting on the IACP state and provincial police division, and the interaction with other states is we're not alone in these problems. And I wish that we were, because then the nationwide fatal rate would be going down. But many of the states are experiencing the exact same problems with us, including Ontario and our neighbors to the north. So my pleasure to be here today. I'm honored to be part of TZD conference. I hope some of what I said was helpful. Can't wait to hear the other presenters and hear about what they're doing and what they're passionate about, and then end with, I think, what you'll find to be an extremely powerful videos. Thank you, Christine.
Thank you, Colonel Langer. It's always great to get your insights and hear what's happening with State Patrol. Okay. There we go. Our second speaker is Sheriff Kevin Torgerson. Sheriff Torgerson from the Olmsted County Sheriff's Office is a graduate of the first ever Minnesota Post Board Skills class. He served with the Hennepin County Sheriff's Office from 1980 to 1985. He was hired by the Olmsted County Sheriff's Office in 1986. Sheriff Torgerson has served in every facet and rank of the Sheriff's Office, from detention to patrol, civil warrants, and court security, training, and emergency management. He's also served on specialty assignments as a DARE officer, ERU and SWAT team member, TZD coordinator, and more. Sheriff Torgerson has also been involved with the Law Enforcement Memorial Association since 1991 as an honor guard member and commander, and now as a board member. Please welcome Sheriff Torgerson.
Good afternoon. I'll wait as we get ready to share things here. I think I can start sharing my screen now, so I'll get that ready to go. And hopefully you're able to see it now. Is someone going to tell me if they can see it?
Yep, we can see
All
it.
right, good. Thank you. All right, we'll get started then. So thank you, Christine, and thank you, Colonel Langer. It's always a pleasure to be in the room with you and hear you speak. It's always encouraging. I've always been kind of a traffic hound myself back in the day, and it's just always good to hear your words and in many ways the inspiring thoughts that you have too. That we really need to continue to devote ourselves. So I'll get moving along here. Today we are talking about the challenges that 2020 has brought our way, but more specifically for me and for my presentation, how COVID has affected us, and then also traffic, which is some going to dovetail on what Colonel Langer talked about, but a lot of this is going to be more in line with what our office is faced with. And granted, as I'm speaking today, I'm not speaking that our response was the response that all agencies should have followed throughout the state, or that it's the perfect scenario or perfect way to respond to this. It was the right thing and the best we could do as we knew, and of course knew the information about COVID, and then all the other things that transpired throughout the spring and then leading into summer and now the fall. So I'll get started here. Let's see if I can get my screen to go. Let's see. I got to tap on that. There we go. So just to give you a little picture of what our office is like, we have 188 total staff. So again, we're not a outstate agency by most people's imaginations, and I imagine some of you are probably a little bit surprised to know that we have 188 folks with our office here in Olmsted County and Rochester. So 95 of them, of course, are, as all sheriffs, are assigned to our detention facility. We're required to have local detention facilities, and then the other 93 are on our law enforcement side. And then our detention center, just again, kind of give you a little bit of a picture of what our office is like. We do have a fairly large jail as far as outstate facilities go. And then as of March 20th or March 2020, we had 138 people that were being housed inside our facility. And I'll get a little bit more into that as we go along and how this evolves and why that's important to us to know about our detention piece of what we do as a sheriff's office. Our patrol division, it still does and consisted at that time of 38 deputies, specifically to patrol and respond to all the different things that local law enforcement responds to. So it's not just, and we can't, unless we have specific efforts at it, focusing on traffic. We're responding to calls from all the different things that you can certainly imagine, or maybe you've called law enforcement for yourselves. So all of our licensed deputies, and this is a good point, and thankful for Colonel Langer bringing this up, that all of our licensed deputies for, I think it goes back to the middle 90s, have had a assigned vehicle that is specific to them and specific to their current responsibilities. So we have 70 take-home squad cars for that, as how that's called. We try to call them assigned, but people more commonly refer to them as take-home cars and look at that as a benefit for the officer, and certainly it is. But this year, I think, proved again how important it is to the community to have take-home cars, and I wouldn't do it any differently. And I know that certainly the State Patrol is in that same mode as we are as far as that goes. So we're divided in our patrol division then with 6 platoons, and they work 12-hour shifts. We've been working 12-hour shifts for, again, and it goes back to probably the early 90s when we started doing that, shifting from 3 8-hour platoons or shifts in a day. And we've been doing the 12-hour shift with a rotating schedule. They generally spend 2 of the shifts will spend approximately 2 months on day shift, and then two additional months or following months on night shift, and then they continue to rotate. You see the shift times there from 6 o'clock to 600 to 1800. And then with us locally, we also have to consider, because we are co-located in many ways with the Rochester Police Department, which is an agency of I think over or right around 200 officers as well. They have 12-hour shifts as well, and but they stagger. They start at 7 and go to 7 or 1900 each day, and then each night. So we also have two power shift platoons that work somewhat varying schedule, but their base schedule, as it's noted there, are generally 2 to 2, with additionally some deputies that work specific contracts with contract cities. Our at the end of March, then, as COVID hit and the pandemic started to take hold and the stay-at-home orders were in place, we noticed a lot of the same things that Colonel Langer was talking about on the other end of it with our detention facility. Again, a factory in what we do down here, because as most sheriff's office do, we commingle our people. They get together. So we had to find ways to try to minimize how COVID might impact our office. And one of those things was to look at different ways to be able to be flexible with the detainees in the facility. Using those different options, we quickly moved with our courts system and agreement to only arresting people on high-risk warrants. So warrants that have situations where people have been injured, or they're about personal safety, and theft warrants, things like that. Other crimes that occur. Granted, they still impact people, but we wanted to go and focus specifically on those folks that and the warrants that are about hurting other people. So we only arrested high-risk warrants. We only arrested high-risk arrests. We still wrote citations. We still did some things that way. If we did arrest someone and they came into the facility, and they would go to court at the earliest convenience, and the county and the courts implemented a pretrial release program, which then also asked people and expected their promise to appear when and if the court system would be back up to speed. And again, just another snapshot of what we're dealing with here in Olmsted County. And this is not unique to us. This is all over the state, of course, and across the country, I assume. We have, as of last count, we're about 5,300 cases or hearings behind schedule right now. So there is a lot of work that our courts are not able to do because we can't put more people in a courtroom and go through these hearings as quickly as we used to do. So that's another big challenge coming out of COVID that we're going to be facing. And then we closed our work release facility, again, to help minimize what we did with detainees coming and going and potentially infecting our staff. And then we use those staff to help support the detention side. So enough of the detention stuff. Again, it's about commingling and keeping our people separated as much as we can. On both the law enforcement and the detention side, we started to implement then ways to and look at ways to keep our people from all gathering in the same places in our facilities as much as we possibly could. We did notice, as Colonel Langer alluded to, our traffic volume as far as the highways went down. Our call volume went down as well at the same time. We were not going to take some of these other calls. Our deputies were taking maybe a theft report over the phone instead of going to a home, doing a lot of different things that we could do to minimize contact with anyone. But again, we can't always do that with certain situations. We did start tracking almost immediately. We started thinking, wow, with these people cooped up at home, are we going to see an increase in domestic violence or DANCO, which is a domestic violence, no contact orders from courts? Are we going to start seeing those things rise? And we did see a slight increase, but not as much as I think a lot of us were afraid of seeing. So then, of course, the community impacts in your own communities, you know what it was like for yourselves in your own communities, the effects of the executive orders. Granted, we want to do what we can to minimize COVID in every way, shape, and form, but the side impacts were critical. Just going back up to the earlier bullet there, we started to see a more significant increase in our person for crisis calls. People were starting to miss almost immediately that interaction with people, kids not going to school. It really started to shake up some people who really crave that need to be together. So we saw a lot of those things happening as well. So at the end of March, we started to look at our mitigation strategies. How could we do these things? We sent staff home to work from home, the ones that could. Of course, some of even our clerical staff can't go home and work. Our warrants and civil paper people in our civil and warrants division, they got to be here. They got to be responsive to court. They got to do the things that need to be done, and they can't do that kind of work from home. We started putting our command staff at home. But here's the key: in both our detention and ADC piece, the third bullet down, we took one deputy off of each platoon, ADC and LEC, and had them work from home. They then became kind of our backups in a sense. If we did start getting some sickness, we could move them to a shift, regardless of where it was, onto a different shift to supplement if we saw a spike or a influx in one of our shifts in any side. And we would have taken law enforcement people and put them in the ADC if we had to. We were ready and prepared to do that. At the same time, we had two deputies who were out of state on vacation, which I think some of you probably were doing the same, or maybe others did. And like me, I canceled the vacation because it was done. We couldn't fly, we couldn't go anywhere. So we had that, and we were concerned because of the quarantine and the limit. Were these folks going to get back from where they were, which they did. But when they came back, of course, we had to quarantine those folks because, again, we just didn't know enough about COVID. We didn't have the testing capabilities to handle it, to make sure that they were safe. And we certainly didn't want them coming back in if they were the asymptomatic types of folks that were very healthy and looked great, but they would be sharing the virus with others. So they spent 2 weeks at home. We did then start working with the Mayo Clinic and Olmsted Medical Center here locally, and started to develop a plan, which we then did supplement with security and support. And we started using 2 deputies a day assigned out to our screening station that Mayo and OMC and the county public health all put together. So a lot of things were happening then at the end of March and leading into April. So we pretty much followed that routine, and it all worked out pretty well into April. And I missed a point, and it wasn't on my slide, and I wanted to add it, and it was too late to jump into that. But one of the other mitigation things that we did is we created a decontamination station. And real early on, it wasn't more than a day or two after we put it in place. One of our deputies arrested an individual for drunk driving, so we had to take her in. We had to process her. We had to sit with her in a squad car and in the room in the facility as we did the testing and all of that. The whole way through, she kept telling the deputy, "I got COVID, I got COVID, I got COVID." We were able to finally talk to some of her family. She had COVID, but that it was at least 2.5 or 3 weeks earlier that she had it. But with that, and her saying all of that, we were not going to take any of that lightly. We had the decontamination station ready. So once the deputy was done, the decontamination station, which is at our fairgrounds, and it's still available today, consists of we had purchased some UV, I guess we call them robots, UV cleaners in a sense, same types of devices that medical folks use, both in the hospitals in some ways. And we used that to clean the insides of our squad cars. And while the deputy was in removing their clothing and taking a shower, and we were washing and laundering their clothing, another deputy, all garbed up, all gowned up and masked and the whole bit, was putting the device inside the squad car and doing a UV cleaning of the squad. So again, not every agency can do these things. We came up with these, it wasn't our brilliant ideas. I think we stole it from somebody else, but we took advantage of that. And During this whole time with COVID, I think we've had now 3 deputies who have gone through the decontamination station. We also had it available for our detention folks as well. If they were to be, get in a situation where somebody may be wrestling around and whatnot in the facility, a new arrestee, and they had COVID or suspected to have COVID, we could take a detention deputy down there and do the same thing. So that was the other thing that we did that I'm sorry I didn't put it on the slides. But now moving on here, then end of April, we started seeing what Colonel Langer was alluding to here. And granted, if you look at the left-hand graph, you look at 2019 to 2020 and you go, well, what's the big deal? You're actually lower in fatalities in your county, and you're actually lower in injuries and lower in fatalities, and the whole thing together. True, but the point is, look to the right. And when we looked at the right, that's what we started seeing. Our neighboring counties were really seeing it as well. We were already starting to hear from our deputies that the speeds were increasing. I noticed it just on my own travels to and from the office, and things that I was doing at the time, that cars were going way faster than I had seen. And even though there was fewer cars, they were going fast. So we started seeing that huge increase. We had 2 in fatalities, serious injuries, and obviously you put the 2 together, it was significant. And so that was what really got us going. We talked to Captain Bogievich, and I think some of our other patrol folks were talking to our other local troopers, and they were seeing the same thing. And we said, okay, we've got to figure out what to do. We've got to do our part to keep Minnesota roads safe, and certainly our little corner of Minnesota and corner of the world, we've got to try to keep it as safe as we possibly can. So we looked at it then at that quickly, and we really do that in Olmsted County down here. It's kind of our just kind of beat into us in a sense, not necessarily beat, but it's something we accept, that we think not only just about Olmsted County, but we think regionally very often. We have counties around us that are much smaller than we are, and we're always willing and ready to help them out, as well as helping out our state patrol partners, because they've always been so good to us. So we want to look at that and try to find the balance again then between, okay, now we've got people at home, we're trying to keep them safe and keep COVID out of our facility, keep it out of our ranks, but yet we've got a big need out here, and people are dying, people are getting hurt on our roads, and we've got to do something. So how do we figure out what that perfect balance is, or what might be an answer to that balance? So end of April, actually leading into May, we saw all of those things happening. I'm not going to read all these bullets. You can see these things. The other factor in this was construction season was getting underway, and we had a big project south of Rochester, just north of Stewartville, where the interchange with I-90 and Highway 63, which are 2 4-lane roads that crisscross our county, as well as Highway 52. And there's a lot of people that come and go out of Iowa to go to work at Mayo Clinic every day, and afternoon and evening and all night long. And we started seeing some challenges around the detours that were put in place. And you know how it is. We all have had those moments where you're trying to get somewhere, maybe on vacation, and dang, you run into a detour, and now what do? You're going to be 30 minutes late because you got to follow this dang detour. And well, what if I take a shortcut? This county road's got to take me somewhere. And then, it causes even more problems. And so what do people do? They go faster, they take more risk. And we started seeing that around those detours. We then quickly just said, all right, this is what we're going to do. We're going to take those deputies away from their online training at home, and we're going to have 1 deputy on each shift start working total traffic. That's all they're going to do. They're going to focus on those detours. They're going to start doing what they can to, at least, like Colonel Langer said, at least get the squad car out there and have a presence in those areas to possibly change those behaviors without even having to do enforcement. So we started doing that. And at the same time, we took our non-patrol deputies. So the ones that that were at home, not working with our courthouse security, we're not doing, maybe we took some people out of our civil warrants area because we weren't serving all the warrants and things like that. We've got some other areas, our training division, we shut down all training. So let's put these guys to work. So we put them out in squad cars, some of them in their squads, some of them were unmarked. So we made them spy cars and we did distracted driving. We were looking for people holding their phones and, doing everything we could then at that point to take full effect of this. We did have a little bit of pushback from staff at first, because again, we were still trying to figure out a way through this crazy COVID thing and how am I going to be infected? And so we did have some concern that was raised, and rightfully so, that, well, what if now you're taking me from my home? I'm supposed to be staying away from this thing. Now you're going to put me right out in the middle of this, and I'm going to be out there making contacts with people. And we had masks for folks. We did what we could there, and we just said, be safe. Just always be safe. Do everything you can to be safe, just like we always do on traffic stops and interactions with the public. So that's what we did. We started saturating these areas, the detours, and immediately we started seeing things change, but we also saw some other, we focused on those other high problem areas that we had started to notice. So fast forward, and of course, in the middle of this, as Colonel Langer mentioned, end of May, George Floyd died, and we started seeing civil unrest, and not so much, certainly not like the Metro. And as Colonel Langer mentioned, the State Patrol folks had to leave and go support the Metro. So we again then said, all right, we're gonna buckle up and we're gonna get out there and we're gonna, back up our State Patrol folks because they're up there helping our partners in the Metro. So we just went at it with that point in mind that we're going to do everything we can to keep our public safe as they travel on our roads, but also still deal with the other things that came our way here. And we did have some rallies and protests and some things here, but certainly not to the scale by any means with what was seen up in the Metro and even in other parts of the country. End of June, our courts did start to reopen. We pulled back those in-house staff that were out doing those spy car duties, and they're unmarked back in because we had to have them back in. And at that time, we still saw traffic volumes are coming up, and again, credit to the State Department of Public Safety folks that were doing those monitoring of traffic things I was seeing on the graphs that were coming out, and Colonel Langer mentioned it too. Those things helped us too. We were looking at those as much, and we were saying, well, the volume is still low, but we're still getting a lot of traffic stops. We're still dealing with that. What are we going to do now to still focus on this and find a different way to deal with it? And so what we did is we created our traffic unit, which is the first ever, and certainly large agencies. I know Minneapolis, St. Paul, and I believe Hennepin Ramsey have had traffic only enforcement divisions in their offices. We've never done that. So we took one of our power platoons and turned them into the TOM unit, the traffic unit. Gave them all new call signs, call numbers, so that dispatch couldn't get them confused with taking regular calls, and they were not taking the theft reports and the domestics and the medicals and things like that unless they had to in a backup situation. They would, or their proximity was close, they would, but they were to focus on traffic, and again, in teams, work on those high problem areas that we were seeing, and certainly the state highways in those couple of weeks when the State Patrol was gone. And then the other thing that we did, and if you haven't followed our office, and I encourage you, go ahead and like our Facebook pages, our social media, on all the formats, Instagram and Twitter and the whole bit. We sent out a lot of messages in our social media, which a lot of people watch, and really told them, hey folks, this is what we're doing. So we had a plan, we told them about it, and then we went at it and did the enforcement and did what we could to try to get people to understand what we were doing. And then hopefully they could change their own behaviors on their own minds, in their own ways of doing things and traveling. But we weren't going to shy away from taking enforcement action if it was needed. So then the TOM unit is still up to today. We're talking now about possibly disbanding that through the winter. But again, we still have traffic issues. And if and when we do that, then it reverts back to our normal operations before, where we'll have our power shift teams do traffic when the calls are low, and we can do some things and really focus on that. But every deputy's job knows, every deputy out there knows that their job is to also focus on traffic when there's no other things to be done, whether it's calls for service or report writing or whatever it may be. So there's some of the statistics that we got during those few months, just tracking that through July and September. And you know, I'm sorry, I don't have numbers comparatively because we've never had a group like this before to say what it was this like in 2015 or something. I don't have that because we didn't do that. But I think what's most significant, again, goes to what Colonel Langer was talking about as the last bullet. We quickly, and I think we had the first traffic stop within 2 or 3 days. One of our female deputies was on Highway 52, and we had our first TOM unit take on a triple digit speeder. And then shortly, I think it was the next day or that night, another one that we had 2 deputies in the area on Highway 52 north of Rochester, and they could not catch up to that guy. And I think that was the one they had registered 124. So we had a lot of challenges through that time, and the traffic unit did a great job and has been doing so up until now. So where are we at today? So our detention center, as it says there, holds 202 people. The DOC has standards that say, you know, we got to separate some people. So generally we're full at about 170. We're back up to about 80, 85 generally now, just because we've had a lot of cases that haven't been able to go to court because court hasn't been open fully to process their cases. So they unfortunately are waiting in our facility. So our courts are open, but still not at full capacity. Our law enforcement folks, we're still not arresting the nonviolent misdemeanor and gross misdemeanor warrants. And our law enforcement folks are looking at where we've been. And unfortunately, we've had 11 fatalities now in our county. In fact, there's another fatality that was a crash and with a fatality just the other night in the city of Rochester that we're still waiting on the autopsy to determine if it was a medical that caused the crash or if the crash was actually what caused the death of the man that was the lone occupant and driver of the vehicle. So we are still going to remain committed and continue looking at ways to try to do all we can here in Olmsted County and Southeast Minnesota to impact those risky behaviors that people continue to do. Because bottom line, we all want to go home safe, and it's about being home and at work and be safe in both places. And there's a neat little picture to end with smiling faces of actually one of those guys is one of our traffic guys and their kids, because that's where it's at. So I'll stand for questions, I think, at the end, and I'll stop sharing. And I appreciate your time today. Thank you.
Yeah, thank you. I love that picture. I'm glad that you shared it with everyone.
You saw that on our social media. That's why you asked for it. So
Right.
thanks for asking, Christine. Yeah, thank you very much.
Thank you. That was really informative. And we did get one question for you, but just so we don't err on anybody else's time, I'll circle back around with that one. So our third speaker is Dwayne Hill. Dwayne's been the district engineer for the Minnesota Department of Transportation in District 1 since 2012. He's a 1988 graduate of North Dakota State University with the BS in Civil Engineering. He has more than 32 years of engineering experience, mostly transportation field, with the Minnesota Department of Transportation. Dwayne also led the governor's statewide bridge inspection program in the fall of 2007 after the collapse of the I-35W bridge. I'll now turn it over to Dwayne. Oops.
All right. Hopefully I'm sharing my screen now. Good afternoon, everybody. Thank you for the opportunity to share MnDOT's COVID response. First of all, maybe I'll set the stage for everybody just to give some background about MnDOT. MnDOT has 5,000 plus employees. And our main mission is to plan, develop projects, oversee construction, and operate and maintain the state highway road system. We also do administer and make sure that funding in the highway user tax distribution fund that goes to counties and cities is spent appropriately. So we have a state aid division that oversees a lot of funding that goes to counties and cities. And then we do all the things that are necessary to support this big operation. And I think the most important thing that I think about is that all of our work has some aspect of traffic safety in it. So what I thought I would do today is share my perspective of MnDOT's COVID response and share some of the nuances of implementing COVID in our large organization. Let's see here. So just kind of as an outline, I just thought I'd talk about our initial pandemic response, some of the things that have come up over time since March, and then some of the specific operational experiences that we've had, dealing with staff, dealing with field work, and dealing with our budgets. So it's very interesting. My perspective is working with 400 employees in northeastern Minnesota, trying to deliver all these programs. And kind of at the beginning of the pandemic, we looked at MnDOT's plans for emergency response. And MnDOT has a very good emergency response framework. And some of the key things are that even in a highway agency, we use incident command structure when it comes to emergency response. Even at the local level, we do. We have a continuity of operations plan. So that really reflects if we have to close our facilities, how are we going to work? And then the emergency response plan has a number of different topical annexes that deal with certain situations. And one of those was a pandemic response. And one of my former coworkers in Duluth wrote the MnDOT pandemic plan back in around 2014, prior to the H1N1 pandemic. And so in the, thinking about the situation that we're in right now, that pandemic plan prioritized all the services that we provide, and it's many, many pages of lists, spreadsheets of services that all the different aspects of MnDOT provides. It sets actions for those services based on the level of pandemic. So it identifies what at different levels, what services we continue to do in the field, which ones we'd suspend, which one, and it really helped us when it came to the point where we needed to consider teleworking, identifying which people would be remaining at work and which people would be asked to go home and telework. The plan also covers every topic that you can imagine on employee health and safety and HR. So things like PPE, facility cleaning. In the HR world, attendance is a really important thing. How do you administer leave? And with the pandemic that we're currently in, there were different versions of COVID leave that we had to administer through HR. And how do we do with union contracts and union relations in a state of emergency? And so the pandemic plan addressed every topic that we've had to deal with in implementing this across our agency. One of the key things in a big organization with 5,000 employees is how you communicate. And I'm a receiver of much communication from our leadership at MnDOT, and then I'm also a deliverer of a lot of communication within our group of 400 employees in northeastern Minnesota. And so what's interesting in this case, in most emergencies that we deal with at MnDOT are like snowstorms or floods, and we're addressing a specific issue that's very specific to MnDOT, and it's dealt with our own policies and resources. But in the pandemic, the pandemic policies were established at an enterprise level, not at MnDOT, but at MMB. and implemented across all the different state agencies. So MMB provided guidance to state agencies. And then at MnDOT, we had a senior leadership group that was our senior or upper level emergency management team that figured out how to implement those across our agency. They kind of distributed that information a variety of different ways, but probably the most important thing was early on in the pandemic, we had manager meetings around the lunch hour a couple of days a week to distribute information, to answer questions, to try to clarify points, and try to be consistent across our agency. Within my division, all the districts report to the operations division. We had also around the noon hour meetings on the days that we didn't have all manager meetings to just talk about tactical things in each district and how we were dealing with the guidance that we received. And then with my group of employees, we stood up our own emergency operations center. Initially, we met daily, and we're at a point now where we have 2 scheduled meetings a week, and we hold probably 1 of those each week. We use technology significantly in our work. And so, you know, we're in a virtual conference right now. We've gotten very comfortable holding virtual meetings with broad groups of people that we never did before. And I'll give a couple of examples. One is all of our maintenance employees are reporting to work just like they normally did, doing the really important work they do in the field every day. And they need to have that touch from leadership on a pretty regular basis in the setting that we're working with. And if you've heard that everyone experiences the pandemic in a different way, when you have a conversation with multiple maintenance people and you start to listen to their concerns, you realize that everybody's experiencing different set of issues in their personal life, and they bring a lot of that to work. So we started doing Skype meetings with our maintenance crews, and we would start at 6 in the morning, and we would have a group come in at 6. We'd talk for a short period of time and then answer questions, and then we'd have another group at 6:30 and a third group at 7. We've done that pretty consistently every week or 2 since the beginning of pandemic with our field employees. And I think it's been a really nice way to communicate with all of them and give them an opportunity to answer questions and hear the concerns of their coworkers. And management's input and assistance is oftentimes we learn of issues that we need to go work on at that kind of communication. Another thing that we've had to do, and I think working in a virtual environment especially, is you don't get to walk down the hall and check in with multiple people at once, and you have to find time to do that. So I actually have to schedule check-in meetings with my direct reports and others that just to see how they're doing with their work across our district, and even my peers around MnDOT and outside of MnDOT. And then one of the last communication things that I'll talk about is the virtual public engagement. In the past, we've had an extraordinary effort to do more and more public engagement. And one of the best examples I would use is that in a really large project that we're working on to relocate Highway 53 up on the Iron Range, the community was concerned about the decision that we're going to make with our project. And we learned early on that if we didn't meet regularly with the community and just give them an update on where we were, even if there was no news, they would make up the next step. And there would be rumors in the community. And so we've established a pretty good routine on our larger projects of having regular communication with the community. Whether if it's during construction, it's weekly. If it's projects that we're developing, it's oftentimes monthly. And we've had to learn to do this in a virtual environment. One of the things that we've found is that when we do a virtual public meeting, we can record it. We can post it on our website. People that don't have time to come while it's being the information's being shown in a live format, they can come back to it. And so we find that we reach a very large audience. It might not be the same audience. We haven't really done a great job of analyzing that yet, but there certainly are a lot more people that are able to view the information that we're trying to show in these virtual public meetings than the number that would normally come in the door when we had the meetings in person. Another thing I'll mention is that within our agency, we have many groups that meet. And I mentioned the manager group and my group of peers in our operations division. And also we have groups of stakeholders that meet to just help us with our planning and policy and program development. And we're finding that they do appreciate the fact that they can participate in those meetings virtually rather than driving. And I'll just use the example in northeastern Minnesota, our geography is about 1/4 of the area of the state. And I have a group of elected officials that help vet and agree to the funding decisions that we make on our road system. We meet quarterly. And the example of our last meeting, which was in October, the group of people that would normally go to that meeting saved 6,000 miles in driving and over 100 hours in time by meeting virtually versus driving to Duluth, for instance, for a meeting. So I'll move on. So this is just the org chart for MnDOT's incident command structure at the highest level, where our chief engineer and our CFO were the incident commanders, and we're just showing a typical incident command structure. So early on in the pandemic, I think it should be interesting to everybody to hear what we did for our operations planning. Our maintenance crews meet or start their day in the wintertime, typically at 7 o'clock. In the summertime, it might be earlier. Our work schedules in the winter are 5 8-hour days, and in the summer, quite often, we go to 4 10-hour days. But anyway, with our maintenance operations, we decided that in order to get social distancing, we would do a number of different things with those crews. And so the idea that we had was that rather than gathering in the break room and sitting around the table and having a cup of coffee, that in order to maintain social distance, they would do their work planning in a larger space, preferably outside, but if necessary on the floor of their garage space. They'd get make their work plan for the day by standing in a large circle, making sure they have social distance. We decided that if we could, we'd utilize split start times for that work group so that we could avoid having all the people in the group there at one time. And we set out with a plan of having one person per vehicle. So we looked at the part of our fleet that we were going to auction off, and we delayed selling that so that we had extra vehicles. And we worked really hard with our fleet managers to make sure that we could facilitate one vehicle per person across all of our maintenance forces and all of our other field crews for the summer. That meant that we had to rent some extra vehicles in order to do that, but to make sure that we had social distance. As we went along, we had many people trying to do innovative things to figure out ways to get more than one in a vehicle, including putting up different versions of dividers in vehicles, using minivans and having people sit in the front and the back, and different things like that. Ultimately, MnDOT developed a policy that allowed 2 in a vehicle as long as both individuals agreed to wear a mask. And some of our operations are such that we just have to deadhead equipment somewhere and drop it off, and you got to have 2 people ride together to come back home. So it was really important to figure out a way to have that done safely. One of the other big things that we worked on was cleaning our facilities. Our maintenance shops, they're cleaned by our maintenance employees. So we had to develop and make sure that they clearly understood protocols for disinfecting and cleaning the commonly touched areas and cleaning their equipment. And we even built into our work plan that at the end of the day, we'd have some extra time to make sure the equipment and facilities were clean before everyone went home. In our construction areas, we had similar discussions. So we have a group of construction engineers that lead all of the contract administration in our projects. And their role during the execution of those projects is to document the quantities of work that gets performed for payment and to verify the quality of the work that's done. So they do a lot of testing, and they had to go through all of their procedures to make sure that they could determine the best methods for verifying if someone has to watch someone do a test and maintain social distance. So they worked through all of the procedures for our construction projects, and then ultimately MnDOT developed a construction project COVID plan, and the AGC group, the Association of General Contractors, also provided a construction project COVID plan to their members so contractors could develop and implement that plan. And it just spelled out how they would ensure that employees maintain social distance, that they cleaned the equipment and facilities appropriately, and minimize the risk of exposure of COVID from one person to the next. So the other big thing that happened early on in the pandemic was the decision to look at MnDOT's workforce and ask those that could to telework. So I think it happened about March 20th, if I remember correctly. And at that time, we decided that we'd close our buildings to the public. And as of today, our facilities are still closed to the public. We use that pandemic plan and those prioritization of services to determine what roles needed to come to work every day and what roles were eligible to telework. And basically, almost with the flip of a switch, we asked everyone to go home and work. And we gave them the ability to bring their computer home if that was necessary. We provided, if they didn't have internet access, we found ways to provide either a hotspot through a cell phone or a wireless internet service, or like a MiFi and things like that, or even a booster for a cell phone if they really were in a trouble spot. And out of my employees in northeastern Minnesota, where cell coverage is really difficult, and internet service is not everywhere, I'm only sure that we had one employee that absolutely could not get internet service when they were trying to work at home. So I thought that was a very positive outcome. Another big issue with telework is the work environment at home. And so in our workplace work environment, we have a lot of ergonomic amenities that we provide for our employees. We have things like sit-stand workstations for those people that work at computers all day, so they can change their position. We have office chairs that are adjustable and can be adjusted pretty easily during the course of a day if necessary. And we allowed our employees to bring things that could be brought home to help with ergonomics. And we also have implemented a policy that we would reimburse them for small items. An example of that might be a wrist pad for a keyboard, or a pad to put your chair on so that you can sit on an office chair on carpet. One of the other big things that we had to work on was procedures for mail. And we worked out contactless drop off and pickup, where we can have people come and get their mail, or we also have our receptionists in our facilities each day where we receive mail, and they're opening mail and scanning it and emailing it to people just to avoid the need to ever come into the office. Same thing with office supplies. We've got contactless pickup. We also have the ability to reimburse people if they want to go to the store to pick up office supplies. And then another big issue has become phones. And not everybody at MnDOT had a state issued cell phone that they could roll their office phone to. So we've been working slowly on trying to implement electronic phones where you do phone through the internet versus you're using your own personal phone for your phone service. Ultimately, out of our workforce at MnDOT, over 5,000 people, about 1/3 are teleworking. And I've been looking at the numbers for a couple of different reasons, but it looks like about 1,625 employees on the average week. And I'll just give you some interesting tidbits about the telework for our employees. Of those 1,625 employees, we looked at, without looking at their home address, but looking at their zip code and their work location, we determined that the average commute distance is about 19.5 miles. And that equates to a little over 30 minutes each way. So that group of employees, by March of next year, will have saved somewhere around 440,000 hours of commute time and around 16 million miles. Those are huge numbers. So I think, and one of the things that we're trying to do as an agency is to really think hard about what happens after pandemic. I think for those that are teleworking, many employees have learned that they like working in that environment. Not all, but many. In the past, as an agency, we didn't do a good job of encouraging those that could telework to telework. And we're finding that our workforce is very effective working in this manner. So some of the things we are thinking really hard about, what do we do after pandemic to change the way that we work and take the lessons learned from this situation and make something really positive out of it. One last thing I'll share, and I'm not going to give you the ultimate computation of this, but there's a lot of research out there that looks at employer savings when they have workforce that teleworks at least 50% of the time. And the numbers are incredible. It looks like somewhere around $11,000 per employee that works at least half time is saved by the employer. And that is something that was developed by Forbes, and it's more of a private business setting, but we're seeing a lot of the same factors when you look into the business aspect of our numbers at MnDOT. One of the other things that we did as an agency is we developed a return to work steering team. And this was based on the MMB enterprise guidance for what's necessary to have employees safely in the workplace. And my personal experience with this group was on a facility and security subcommittee. And our role was to make sure that we could have employees working in our facilities in a social distant manner, and make sure that they were clearly informed of the risks and the best practices during a pandemic. So our some of our main tasks were developing guidance around signing for our facilities and circulation patterns to minimize the risk. And one of the key things with that was looking at building or room occupancy in our facilities and signing that occupancy, providing signing about hand washing, social distancing, mask wearing, and such. And then ultimately, this whole effort results in an ongoing audit of our workers that are working in our facilities to ensure that they're following the COVID safety procedures. Some of the other things that we learned as we're responding to the situation that were pretty interesting, and everybody experienced supply shortages. And I think MnDOT was one that really struggled initially. So I had a bottle of hand sanitizer that was sitting on my desk from the H1N1 flu outbreak. So it was somewhere around 8 years old and expired. And in order to get a new bottle of hand sanitizer, it took about 2 months for our procurement people to be able to actually order and receive hand sanitizer. One of the other interesting things that happened was we put all the N95 masks that we had in our inventory into the strategic stockpile of medical supplies. And suddenly we didn't have any kind of PPE for our employees. And it took quite a while for MnDOT to be able to order and have received delivery of face coverings. As an agency, we developed enterprise-wide, they developed a employee status tracker so that they knew which employees were at work, which ones were teleworking, and which ones were either on vacation or some other type of leave. And we also did local attendance so that we could do contact tracing when we had presumptive or confirmed COVID cases. We suspended our training, and we've really struggled with, we converted a lot of training to online, but we've really struggled with providing that training that needs to be hands-on. And an example of that is like today, I have one group of maintenance employees that's doing a backing exercise, and they had to schedule each employee to come in at a separate time to practice backing their snowplow through an obstacle course. And it had to be done in a way where they had to make plans to clean the vehicle in between each person that used it. One of the other big things that we've worked on as a response item is making sure that we could respond to snow and ice situations. And I guess the biggest fear that we have as an agency is that we would have a whole work group that would get sick. So I'll just use the example of my group that's in Floodwood, Minnesota. They're responsible for plowing snow on all the roads in about a 30-mile radius of Floodwood. There's 6 employees. They work pretty closely together on most days. And if they infected each other and they were all out at the same time, I wouldn't have any employees in that particular area to plow snow. So what would we do? So we've developed a response plan that's various levels of redeployment of our own people. And then as we, if the situation was so bad that we didn't have people to redeploy, then we start to reach out to others, whether it's local agencies or contractors, or even at the end, possibly the National Guard, to make sure that we provide that critical snow and ice service to the public. Moving on here. So some of the interesting operational experiences, one of the biggest things is dealing with our employees. And our HR director that works with me always tells me that the most serious calls about somebody that's gotten sick with COVID come at what she terms as COVID hour, and that happens to coincide with happy hour. So it's usually late in the day or very early in the morning when the employees let their employer know that they are sick, that they're either going in for a test or that they got a test result, and then suddenly we're in a situation where we need to figure out where have they been, what facilities have they been in, what equipment have they been in, who have they worked with, when they did work with somebody, how close were they, how long were they together, did they wear a mask, do we need to be concerned about quarantining somebody or not? And it's quite a exercise to do that. And when we have had these confirmed or presumed cases and they've been in one of our facilities, we developed a policy that says we would basically keep people out of that area until we're able to clean it, or until the virus dies, which we're assuming is 7 days. So we've had many instances where we've had to put up signs on a facility and tell all the employees that work there that the building is closed. But yet we have this dilemma that we can't say why. They know why, but we can't say. And it's really an interesting conversation. And we have the employees tell us, we want to hear from management what exactly is going on, who's sick. And we will just constantly have to respond back. The ADA prevents us from disclosing health information, including information that might lead you to deduce who is sick. So that's a really important factor for government entities. And so we end up using the terminology like this. We've had with our whole work group, we've had lots of opportunity to learn about what might happen if somebody has a presumptive case of COVID, and we might have to close a facility. Or I might have to say, you know, there's an elephant in the room, but I really can't talk about it, which isn't one of my other favorite ones to bring up. But ultimately, you know, the number of cases of COVID, especially the confirmed ones across our whole agency, has been increasing pretty rapidly recently. So I put on a table of numbers I heard at a meeting recently. Through June 30th, MnDOT had 12 confirmed COVID cases. Through the end of October, the number was 72. And by the end of the first week of November, it was 95. And I know locally in my region, Monday morning, our HR director had 18 COVID-related calls. I don't know kind of the details of all those calls, but I mean, that was a pretty busy morning for our HR office. And I think that really just reflects kind of what's happening in society right now. So I thought maybe the next thing I should just talk about is budget and the budget impact of the situation on the Highway User Tax Distribution Fund. And so initially MnDOT looked at projections based on the very first glimpse of what we saw with traffic on the system when the governor instituted a shutdown. And our initial projections were pretty bleak. But what we found through August is that we're down, our projections are kind of adjusted a little bit, and the projection through August is that our fund was down about $112 million, which is on a $2.3 billion a year fund. So about, what is that, 5%, a little over 6%, something like that over year. And so, you know, in the general fund agencies are really concerned because tax revenue is going to be down also. But in MnDOT, this money is spread across construction projects. It's spread across our operating budget. We've looked at ways to kind of manage our budget going through the biennium and trying to figure out ways to balance our projected deficit. And so that resulted in some discussion about set aside funds that we had and reallocating them to the deficit, some minor adjustments and delays in projects, making very controlled decisions about hiring. So it's not a complete hiring freeze, but every hire has to be approved through our deputy commissioner level. And then we've experienced significant savings in some areas of our budget lines. So travel and training are one of them. And I use that example of that ATP group, that one meeting with my ATP. Those people that went to that meeting saved somewhere around $14,000 in time and travel expenses. And we've had many, many meetings, such as even this TZD conference, where lots of MnDOT employees would have traveled to the conference location, had meals, had mileage, had hotel rooms, and that's just not happening. So that's been one place in our budgets where we've been able to actually save money. Another example is because we don't have as many employees in our building, our electricity and heat and fuel bills and water bills are going to be a little bit less. And we looked at one facility where it was down, it was about 12% less than what it had been in the past. So across our operating budget, that's a small, that's a portion that helps our budget. And then maybe the last thing I thought I should talk about is productivity. And I should have said this right at the beginning, but so MnDOT's overall impact to the economy is $2.3 billion a year. And it was critical at the beginning of the pandemic to find ways to make sure that we had a construction season over the summer of 2020. And our news release from a week ago talked about wrapping up about 200 projects across the state of Minnesota. And I think that it was very successful to be able to deliver those projects with very few COVID-related impacts. So that was a very positive. And almost every one of those projects had a highway safety aspect to it.
Rain, you've got about 1 minute.
Okay, I'm ready. And so, I'll mention that, that's really important. And also the road maintenance that we do is really critical. And then lastly, developing our projects for next year is something that's high on our list of importance, just because that we want to have that same economic impact in 2021. And we seem to be able to develop these projects in this telework situation and get them ready for letting. And I think that's really paints an interesting picture about how you make an abrupt transition of how you do work in a very short period of time. So maybe I'll stop there and say thank you very much.
Great, thank you. I even learned some things, and I'm a MnDOT employee, so that was great. Okay, our next two speakers are Peggy Sue Garber and Maria Floor. Peggy Sue is a trauma, stroke, and injury prevention coordinator with Mayo Clinic Health Systems. She's been a nurse since 2004. She was motivated to go into nursing in 2001 when the terrorist attacks brought down the Twin Towers. Like most nurses, she started on the general floor and eventually ended up in the emergency room. There she found her love for trauma care and enjoyed the process of helping patients get better. Eventually, she assumed the role of trauma coordinator for the Mayo Clinic Health System in Fairmont. This involves chart reviews, directing trauma classes for ER nurses, maintaining the hospital's trauma designation, as well as performance improvement. As the role grew, she was asked to take on injury prevention for the Southwest Minnesota TZD program. She participates in many TZD events, is a voting member of the Southern Minnesota Trauma Advisory Committee, was previously a member of the State Trauma Advisory Committee work group that revised the Level 4 trauma hospital criteria, and also participates in the Martin County TZD Safe Roads Committee. Maria is an RN and trauma coordinator for the Mayo Clinic Health System. She's been working as a nurse in the rural hospital since 1998 and has been the trauma program coordinator at a Level 4 trauma hospital for nearly 10 years. She's active with the Southern Minnesota Regional Trauma Advisory Committee and involved with various injury prevention and education outreach projects. Maria is also the current Level 3 and 4 trauma program manager representative on the Minnesota State Trauma Advisory Council. Welcome, ladies. I'll turn it over to you.
Thank you so much.
I'm coming.
So we're going to be representing the Emergency Medical and Trauma Services E of TZD, and really this is the piece that really provides that fast, efficient emergency and trauma services to reduce fatalities and serious injuries whenever a crash does occur. So we're kind of at the end of the spectrum from what many of our partners have already discussed.
Yes, and thank you all for joining us. We're so excited and honored to be able to join this panel and discuss, the ever-changing pandemic and how it affects our lives and the lives of our patients. So, impacts on healthcare during a pandemic, the list is long, but our goal is always to provide the best care possible while preventing staff exposures. And in the beginning, that was our biggest fear, is in the emergency department, in our clinics, as people are coming to us to get tested and be treated for multiple issues. how are we going to protect our staff? Because if our staff go down with COVID, who's going to take care of the patients? And way out here in rural Minnesota and our small facilities, we don't have a large pool of people to pull from. So that was a real concern for us. In the beginning, if you recall, there were multiple changes in PPE guidance from the CDC, from the WHO, and all of the entities kind of had different ideas on what mask you should wear when. And we saw a lot of that in our facilities. Sometimes the guidance would change 2 or 3 times in one day and be communicated through email. So, you know, and if you're not familiar with how it works in healthcare, nurses aren't typically on their email all day, every day. So oftentimes they would be in the wrong PPE at the wrong time because they didn't get the new email, which really, when it comes down to it, we realized that after the dust settled, we had everything we needed, and it was just really confusing. And there's many different types of masks, and we'll go through that. But fit testing was something that we had to do on a regular basis. And fit testing is for the N95 masks. You have to be fitted to make sure that they are fit to your face to keep you safe. The regular cloth masks and surgical masks and stuff like that don't need to be fit tested, but an N95 does. In the beginning, when the shutdown happened and COVID really started to rise in numbers, the availability of supplies kept changing. So the masks that we had an abundance of this week, we couldn't reorder because they were gone. And so we would have to switch to a different mask. And when that happened, you had to refit test everybody you fit tested on the other mask because it's a different mask. So in order to know that you are safe, we had to refit test everybody when a new N95 mask became available due to the sheer numbers that we need in healthcare to keep all of our staff safe. So that being said, to help keep our staff safe and healthy, we had to close some entrances. So we weren't having people coming in through all doors of our hospitals and clinics, and went down to 1 or 2, just so we kind of kept a tighter rein on the comings and goings of people, especially when the no visitors came in, policy came to effect. It just led to a lot of changes and moving things around. Then we went to no visitors, and that was difficult for a lot of, especially in our emergency department and obstetrics, not having any visitors. That's really hard for families. And then many staff that weren't at the bedside taking care of patients were transitioned to working at home, just like every other agency in the country. But what we did get was unprecedented support from our communities, and in giving gifts and support and masks. People were sewing masks and bringing them in boxes. And so that is one thing that I really have to say was something that we really appreciated. I'm going to let Maria talk on the next slide. Take it away.
Yeah, so some of the things that any hospital or healthcare has to do is look at those elective surgeries and elective visits and sort of pare down to what's the priority. So some of that had to get canceled early on, and then we were able to bring it back later or do it differently. A lot of our clinic visits were able to be switched to phone calls initially and then video, virtual visits. So I think many in healthcare had a vision for virtual visits in the future, but maybe not quite this quickly. So this has really sped up that process. And I think that's something going forward we'll just hang on to and refine, and we'll be ahead of where we thought we were going to be before COVID happened. The COVID testing, as you all know, has evolved, and how we do that, where we do that, what's the protocols, that has continued to evolve and affect how we do that. And every clinic or hospital has a little different way that they're doing that, so I won't go into that further. But also some of the things that we had to change was we had to limit who was in the patient room, not just with the visitors, but in some critical situations to care for our patients. Maybe in the past we would have 6 or 7 staff in the room, but now in order to protect our staff, we had to critically look at how do we provide this care? Can we do it with less people? Can we be clear about who's doing what role, and limit that so we have less people exposed, less people in full PPE, and those sorts of things. So lots of changes.
So tagging on to that, changes in practice, you know, with the number of people going into the bedside, how that changes, like Maria said. We also, you know, in Mayo and a lot of the hospitals in the metro have residents and training and people on orientation and student nurses. All of those extra bodies were no longer, you know, coming into the patient's room. So it kind of put a big gap in how that all moves forward during COVID. We want to keep our patients and staff safe, and having extra people just didn't make sense. The additional PPE for aerosolized generating procedures, which is a healthcare term for a neb. You know, anytime you give somebody nebs, a nebulizer treatment to help open their lungs up, that mist can come into the air. And if they have COVID, it makes the virus more easy to travel. So the PPE that everybody had to wear for giving a nebulizer treatment to a patient changed. We added filters to the nebulizer equipment to kind of help filter some of those germs out. So we look at every process and try and make it as safe as possible while still maintaining that top-notch medical care that our patients deserve. We talked about some phone and video visits through the providers. I know there's some talk about even bringing some of that to the emergency room maybe in the future. I'm not sure how that will look, but I know they're looking at that. But with concerns to traffic safety and the TZD mission, we created some drive-through clinics for those who are on blood thinners and need to get their coagulation studies done. Instead of coming into the clinics to get that done, they've got drive-through clinics for that, just like they do for COVID testing. And some days the drive-through COVID testing, the lines were down around the block, impeding traffic at times. So we moved our COVID drive-through 3 different times from the beginning of when COVID started to where it is now. So we're always assessing and reassessing and problem solving. What can we change? What can we do better? All the while keeping everybody as safe as possible, because, you know, in healthcare, you know, you're going to be exposed, you know, you're dealing with somebody with COVID. So you have to be on your game at all times. Transfer delays, you know, when you work in an emergency department out in rural America and down here in Fairmont and in St. James, we are an hour and a half by ground to our facility that we transfer the majority of our patients to in Rochester. And an hour and a half by ground is a long time when you consider you're taking your ambulance crew out of your local area for potentially 3 to 4 hours for one trip. And if the EMS crews come down with COVID or are in isolation due to an exposure through a family member or whatever, Then we're down an ambulance crew. So we've got emergency room patients that need to be transferred to a higher level of care, but we don't have enough rigs and EMS to get them there. So, times in the ER tend to get extended. And at the same time, when that happens, sometimes you can have an ambulance on the way to come and get your patient, and then a critical event happens that diverts them for a life-saving measure, a car accident or heart attack or whatever. And then you have to start the process all over. So our wait times to get people out turned into quite long waits. So it does impact our patients in a number of ways. Maria?
Yeah, so we just wanted to explain a little bit more about fit testing. So there's lots of different kinds of masks, as Peggy Sue had talked about. And the N95, which everyone, thanks to COVID, has gotten familiar with that term, but that type of mask prevents 95% of particles from getting through. So that's the most protective mask without being in a full, what looks like a bomb suit. So that mask needs to be fit very well. So in the picture on the screen, that first picture that looks kind of funny, it looks like they have marshmallows on their heads. We're actually doing the fit testing. So we use a solution. It's like a bitter tasting solution. So you make sure that they can taste that, and then they fit their mask as well as they think they can. And then you put that goofy looking hood over, and you do a whole series of exercises, from talking to nodding to moving around, things like that, and see if you can taste that bitter solution through your mask. If you can, that means your mask doesn't fit right, and you need to start over. But if you can't taste it, that means you have a good fit, it's the right size mask, and that sort of a thing. So N95s are used for lots of different things. They're used to keep, people that paint or use chemicals, or in our case in healthcare, to keep the germs out. So we have to do that process, like Peggy Sue said, when the product changes, or we have new staff or staff that previously weren't in a position of needing that now do. So it kept us busy. And then the solution, that bitter solution, we would run out because we used so much of it. So we were actually creating it, but some of the same materials that you use to create that bitter solution, they used to make hand sanitizer, which of course was in high demand. So sometimes we had to wait a while and share our bitter solution. We're running that back and forth between hospitals and that sort of thing. And then we had different partners come to us, some law enforcement partners, county partners, that said, hey, can you help us with fit testing? We're getting some N95s. But we didn't have the resources or the manpower to be able to help them. And previous to COVID, we thought, oh, if we ever have a pandemic, we'll help each other and we'll come do your fit testing or help with that. But it really didn't pan out that way, at least in southern Minnesota.
So the next thing I want to talk about is a PAPR. And a PAPR is just a mnemonic for a powered air purifying respirator. The picture that you have there is, there's a little machine that kind of blows air that goes into the hood, but there's a HEPA filter that filters out all of the contaminants. So you are basically safe from any outward contaminants. So they can be used by staff who are medically certified, but who cannot wear an N95 disposable respirator / mask. So who are those people? The N95 respirator choice that is available either doesn't fit that person, if they have facial hair, if they have health issues related to wearing a mask, or if they have a deformity. Like sometimes people who have had a broken nose have a really difficult time getting the mask, the N95 disposable mask to fit properly. And then for those aerosolized generating procedures, if they don't have an N95 mask that fits them well, this would be what they would go to. So that's what a PAPR is, and they're available. It isn't something that you have to get fit tested for. Anyone can wear them. And that's what we fall back on if there are staff who cannot wear the disposable masks for any reason.
So many of the staff considerations that healthcare experienced is very similar to what has been described by the other groups as well. But, you know, staff know that they're around sick people. We do our best to use universal precautions every day, but from time to time, you carry germs home, and, you know, people are stressed about that and concerned, justifiably. So some of the extra precautions that people would do would be, you know, changing at work and showering before they leave work. You know, sometimes leaving scrubs on site to be laundered, or maybe bagging them up, that sort of a thing, so that they weren't contaminating their family or their vehicle, things like that. You know, we really saw some amazing teamwork and creativity despite these unique challenges. Now, you know, staff live in PPE all the time, and it just gets more intense depending on the care that they're providing. So lots of stressors, like everyone.
So isn't it ironic that we have a pandemic going on, and we have fear and uncertainty for healthcare providers as to whether or not they're going to have jobs? I mean, we had furloughs, we had layoffs, we had staff reductions, which didn't seem possible with a healthcare crisis on our hands. But with a pandemic, patients were afraid to come to our clinics and our ERs for fear of getting exposed, because they knew that COVID positive patients were coming to our facilities, and they were scared to come and get treated for their yearly, or even if they were sick, or even stroke symptoms, heart attacks. Those kind of patients that were suffering from those things would hesitate about coming to the hospital and getting treated for those things, which was really scary for us, because we were seeing patients that normally would have come in as soon as their symptoms arrived and were able to intervene, and they're waiting longer, so then they're more seriously ill when they do get to us. So it just seems like very ironic that during a pandemic that we would be concerned about having enough nurses and having them be laid off and furloughed. But when you have to staff your facility to the demand, and the demand just kind of disappeared for a while, that's kind of what happened. Now that's coming back, but that's not something that any of us anticipated coming into this pandemic.
We've got about 2 minutes left, ladies.
Perfect. So just to touch on the civil unrest and how that impacted healthcare, you can see the bullet points on the screen there, but having National Guard at some of the hospitals in the metro area, things like that. But it also shut down our helicopter services in the metro area towards the end of May, which really impacted patient safety and us needing to get patients, medical patients, but due to increase in law enforcement and media air traffic reports of laser pointing incidents, drones, shootings in the area, things like that, it was just a safety call. So it got real interesting in how we move our patients.
We do have an impact story that I will, due to time, really pare down to a very brief story. We'll just say a gentleman fell in July after he mowed his yard at the farm and broke his leg. So he was taken to a local hospital, and he was COVID negative, had surgery on his leg, was in the hospital, remained COVID negative throughout his stay, and was discharged to a local nursing home for physical therapy to get him stronger to get home. And it was a great nursing home and had no COVID cases there. But in the nursing homes, we all know no visitors were allowed. When he was in the hospital, his wife and family could be there and assist and be in the know about his care. When he went to the nursing home, no visitors. So he was basically isolated. And throughout that time in the nursing home, he got more weak because he wasn't moving around. And because his family wasn't involved with the day-to-day stuff, he ended up getting decubitus ulcers that made him less able to move around. And his physical therapy had to stop. And so long story short, he never got COVID. COVID wasn't even an issue, but because of all of the things that we have to do to try and keep patients safe, he'll never get to go back home. And one of the things reason why I'm sharing this is for all of us to understand that our families are our partners in patient care, and COVID kind of took that away from them. And a simple non-displaced fracture became a recipe for isolation and now financial devastation for that family that has a farm that's been in the family for 150 years. They're now having to sell to pay for his care. That wouldn't have necessarily happened if COVID wasn't in our lives and he was isolated and all of the things that kind of made this perfect storm. So that's kind of in a nutshell the story. But on that note, it's just really important to try and stay as involved with your family's care as possible, even in the midst of COVID and the restrictions, any way you can.
Thank you.
Thank you. Thank you for having us.
There we go. You both, that was very interesting. It was very interesting. I'm glad that you share that with us and the impacts for the COVID patient. I just want to thank everybody and our speakers for coming today. We do have the video still at the end, but I've got a couple other things to go through. We want you to follow us on social media, not just Sheriff Torgerson's social media pages. And then I will turn it over to Director Mike Hansen from the Office of Traffic Safety to talk about the State Patrol's new video. Go ahead, Mike.
Okay, thanks, Christine. Colonel Langer had to sign off for another meeting, so he asked me to introduce the video. What you're about to see is the story of what led up to and then the aftermath of a crash that I think many of us are familiar with. It took place on Highway 36 in Lake Elmo on February 27th of 2018. And there is no better example of the cost and the price that we all pay for critical errors that drivers continue to make, especially when it comes to distracted driving. And for all my law enforcement partners out there, I know how hard this is to enforce, but it is just as deadly as any of the other factors that we see and that we talk about out there. We have a good tool on the books with the hands-free legislation. Certainly, there are some ways we could make it better, but it just comes down to us working with our citizens, with our constituents, with our stakeholders, and getting everybody to make better voluntary decisions behind the wheel. As Colonel Langer says, anybody who's worn a uniform will agree. There's no way we're going to enforce our way out of the mayhem that's taking place on our roads right now. We need to change behavior in a conscious and in a proactive and in a personal way. We can't treat the roads as our selfish and our own racetrack. It's a cooperative venture. So with that, go ahead and cue up the video, Christine, and we'll start. Everybody stay safe and stay healthy.
I play that moment in my head multiple times a day. There wasn't anything I could do. I was out of control. From the time that I looked down at my phone to the time that I looked up, 8 seconds had passed. I never realized how far you travel in 8 seconds.
We see it too often, and Tuesday was another example where someone's killed on our roads for no reason other than someone else's poor choice to make that phone more important than driving. We shouldn't need a law to tell us to pay attention while driving. We should just be paying attention while driving because we know it's the right thing to do. And had that happened on Tuesday afternoon, there's no doubt in my mind that Mr. Bursick would have been home.
He was stopped at a stoplight, and I hit him when I was going 63 miles an hour, and hit so hard that my truck went on top of his car. And I couldn't steer. I couldn't. The brakes didn't do anything. I couldn't do anything.
I've heard the reports that the fire department took hours to get him extracted from the vehicle. That is a haunting image in my mind that I think about all the time.
We'll never get to see our dad again. And it's all because of the 8 seconds that Sam decided to look at his phone.
Robert and I were married on March 23rd of 2013, and he died just short of our 5-year anniversary. He made people feel very welcomed. He was always kind of the life of the party. He was never afraid to laugh at his own jokes. He really cared about humanity, the environment. I have 2 stepkids who are older, and when we were married, he really wanted to have another child, and of course I did too. So Ian was born in 2011, and he just thought it was the best thing. Even though he was an older father, he just looked at it like, how lucky am I to be able to get to do this again? He's missed out on so much. He's missed out on his daughter's wedding. He's missed out on the birth of his grandson. He's missed out on his son graduating from college. And Ian has missed out on not growing up and sharing a lot of those things with Rob that you hope every kid and father get to do. And he missed out simply on, somebody's poor choice. It's been difficult. He misses his dad a lot.
My dad was the most energetic, outgoing, loving, funny guy almost anyone has ever met. He was that guy that just absolutely lights up a room when he steps into it. The big thing that we were planning when my dad was killed was my wedding. He was going to walk me down the aisle. So my uncle Paul, my dad's brother, had to walk me down the aisle because my dad wasn't there. My son was born in June of 2018. I can only imagine what an amazing grandpa he would have been. I feel devastated for my little brother Ian. I feel devastated for my brother Colin. I feel so sad for my son that he never got to meet him and have him as a grandpa. I feel so horrible for my stepmom. It's just so hard to think about the fact that he doesn't get to be here for the world and continue making an impact.
The day of the crash, I was leaving my second to last stop. And I got on the Highway 36 going east towards Wisconsin. And meanwhile, while I was driving, I got a message about a house that my girlfriend at the time was looking at. And I pulled out my phone to look at it, to see what she was talking about. I thought it would be fine. I thought nothing will happen. During those 8 seconds, the time went by so fast. I traveled a lot farther than I ever thought I would have. I looked up just before I hit the vehicle, and my truck went right on top of his car that he had and pushed him all the way through the intersection. And I got out of the truck as fast as I could, and I ran back to the car. By then, it sank in fully that it was too late.
When I found out about Rob's passing, we were actually going through a very difficult time. My son was in Children's Hospital, and he had a bad eye infection. He was getting treated for that, and a nurse came into the room, and she had just a grave look on her face. And then a state trooper came over to me and sat me down in a chair and told me the news. And I remember, maybe about 20 seconds of just numb, staring at him, and then having to go into the next room and tell my son that his father was killed in an accident. He immediately started crying, and the first thing he asked me is, will I be able to get a new dad? And that was devastating.
When I think about Mr. Bursick, I think about his family. I think about him being a dad. I think about him being a professor. I think about his greenhouse that he had, which was his business. I think about his kids. You definitely don't want to be that person that takes somebody else's life. You don't want to go to jail over it. You don't want to hurt your own family and their family. At the time of the crash, I was a single dad raising a young son and a young daughter. Over the time I've been in jail, my children have missed out on me being there for Christmas, for Thanksgiving, for their Christmas concert. And they've just missed out on me being there every day as I was before. I know in the future my family will get to have me back for holidays. But Mr. Bursick's family won't have him back for any future holidays. It's heartbreaking to know that that happened, to know that I caused that, to know that it's my fault that they won't get to enjoy another holiday with him. I can't say I'm sorry enough. I can't tell you how bad I feel knowing that you have to grow up without your father. I wish I could take it all back. I wish I could change the events. Getting one text and checking one Zillow link led to an entire life of regret, remorse, sadness, heartbreak. I don't think drivers realize how long they're actually looking at their phone, not paying attention to the road. It doesn't matter who you are. It doesn't matter if you wear a suit and tie. It doesn't matter if you wear jeans and boots. It doesn't matter what you do for a job. This can happen to anybody. All it takes is one poor decision.
Every time I hop in my car, I see people driving distracted. And I just want to stop the person and shake them and tell them, do you have any idea what you're doing right now did to my family? Do you have any idea what that did to my family and what you could do to someone else's?
Hey, Jace, Ian's doing well, responding nicely to the antibiotics.
My dad left me a voicemail updating me on my brother Ian's condition at Children's Hospital the day that the crash happened.
So just wanted to let you know, if you're having a good day, I'll talk to you later. Love you, bye.
We have the memories, yes, but we'll never get to see our dad again. And it's all because of the 8 seconds that Sam decided to look at his phone.